A mastectomy means removing the entire breast. Now, there are different kinds of mastectomies. Historically, a long time ago, we removed everything in the so-called Halsted radical mastectomy. It was a disfiguring, horrible surgery, but worked in its time. We then made a transition to a modified radical mastectomy, where we still removed all of the lymph nodes, but we started saving muscle and saving more skin. Then we transitioned to skin-sparing mastectomies, meaning now we're saving more of the skin, and if we're saving more of the skin, that allowed us then to start doing immediate reconstruction, often with tissue expanders or rotating an area of normal body tissue into that spot. And we've now most recently started transitioning into nipple-sparing mastectomy, where we're saving all of the skin of the breast, the nipple and areolar area. Historically, mastectomies always meant removing all of the lymph nodes, but again, fortunately, over the past decade or so, we've transitioned into sampling the lymph nodes to see if they're involved. That's called a sentinel lymph node technique, done with either lumpectomy or mastectomy. And if the lymph nodes are involved, we've historically removed them, all of them, called the level 1, level 2 nodes. Think of the lymph nodes in the armpit area, and the axilla is like a cluster of grapes hanging in some fatty tissue. We remove those. Interestingly, if a patient now is having a lumpectomy and radiation therapy, even with a positive sentinel lymph node, we may not necessarily have to remove all of the lymph nodes. So what I've tried to describe then is a transition from the most radical now to far less radical, but with even better results with what we're doing now. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.